Hello, everybody, and welcome back to Broken Brand. And tonight we are going to talk about ketamine. Now, I I saw this article and I wanted to go watch the interview where Don Lemon interviews Elon Musk. If it wasn't for this topic, I would not have watched the interview, and I actually stopped watching the interview after they moved on to a different topic because this is what I wanted to see what was said. I don't like to be political, um, but I will say this. Um, Don Lemon is a terrible interviewer because right at the start of this section, he says, "You use you posted as you use ketamine," and he goes, "Yes, I have a prescription, and I use it for depression or misaligned chemical states in my brain," and that should have been the end of the discussion. But Don Lemon kept pushing it, trying to get more information out of someone's personal medical treatment. And Elon Musk was pretty fair in trying to push off, this is my thing. I don't want to talk about it. This is my personal thing that I'm dealing with, and talking about what investors say and all this. And the reason it's like, oh, because he uses ketamine. Now, for the last 5 years, there have been studies done with ketamine and psychedelic mushrooms to help those that suffer from severe depression, lifelong depression, severe anxiety, to help reset some of the neural pathways and chemical imbalance within the brain. These are controlled studies, controlled things, and it's probably been going on a lot longer than that, but I know I've been following it for the last 5 years. It's always been a topic that has interested me since I've taken about 80% of the different SSRIs on the market. It's always been, do I want to do this? Is this something I would consider? I still wouldn't, because I have that. I have the Irish gene mutation, and a lot of drugs affect me a lot differently than other people. That's why I don't. The hardest thing I take is Tylenol cold and sinus. I mean, seriously, that is Advil cold and sinus, I think is what I actually get. But I mean, even prescriptions for pain medication, even after surgeries, I've told them, don't prescribe it to me. I don't know what it's going to do. And some of them I do. And I say, don't, if you're going to prescribe me these, don't give them to me. Just don't. Because I know what it does to me. And I don't like it. And I will get through it. But some people have various different things, react to drugs differently. And that's just how it is. But the whole interview was on this topic, was trying to spin it that he is a recreational ketamine user. And I think that's what Don Lemon was trying to push. And I'm looking at Elon Musk as a person who has a medical issue that he's trying to treat with his doctor. And he keeps pushing it. Well, use ketamine, use ketamine. Well, ketamine treatment has been legal for treating depression for a number of years now. And psychedelic mushrooms will be soon. It is in some states, not federal, but in some states it is legal for this type of treatment to help with those with severe depression and severe anxiety. And you shouldn't, it's just like someone being made to feel bad because they have to take Xanax for panic attacks. Something like that. I mean, something was like someone who suffers from panic attacks. Oh, and panic attacks hurt, and they're severe, and they're very painful physically. It's not just an emotional thing, it's a physical thing too. And a little bit of Xanax helps settle the body down to help it move past this, what's it called? Acute event. And this is a good thing. This is what medicine and the medical profession should be doing. They're taking drugs and different treatments to treat medical issues. And this is one of those things that I was like, This is cool. This is something that me does. Can it be abused? Of course it can. I've taken drugs uh, prescribed by my doctor that I know for a fact have been used for recreational use. I never use them for that use. And 90% of the people that get these prescriptions don't use them. They're trying to treat something that is going on with them. They're not trying to have fun, trying to lose their mind, and they're trying to treat and help themselves. And that's what Elon Musk is doing. He is taking a treatment prescribed by his doctor, overseen by his doctor, and this is not something that should make him feel like less of a person, and he should not be attacked for taking it. All he did was mention on Twitter that, hey, ketamine is being used to help treat depression. Here are some studies that are being done. Here are some things, information to go educate yourself on it. That's basically where this whole line of questioning came from. And basically, even though this article really is just kind of, I mean, if he was taking Prozac and they brought this up and been like, oh, well, yeah, my investors want me to keep taking Prozac because, when I get in these really bad just these bad mental days and I just can't shake it, I take my medical treatment from my doctor and boom, I feel better. I move on. I get past it and I go on with my life. That's what he's doing. The only reason this is a big deal is because it's ketamine. And there's a lot of narcotics used in medications throughout the world. Not just US. I mean, anesthesia is basically a narcotic and poison. You know, most chemotherapy is legitimately poison, but they are treatments prescribed by doctors, studied by the medical community to help treat a condition. That's what we're seeing here. He's using a medical treatment to treat a medical condition, and this should not be frowned upon or stare. I don't even know what do you even want to call that? Just despised, almost like, oh, you shouldn't be taking that because ketamine's bad, and well, my doctor prescribed it. I have a prescription. I take it as it's prescribed. This is no different from someone taking Prozac, Xanax, insulin, anything else, high blood pressure medication, whatever. This is a medical treatment for him. And the way Don Lemon just went after him over and over, I was like, this is ridiculous. Because even he said, I shouldn't be telling you this. You shouldn't be asking me this. This is a private medical condition. If I came to you and said, I want to talk about my medical condition, that's a different topic. That's a whole different ballgame. I'm coming here to inform people about a medical treatment I'm taking so people can learn. That's not what this was. It was more of like an attack on Elon Musk. And I know it's like I'm really defending Elon here and crapping on Don Lemon, but really what I'm saying, if these were any other people, pick some interviewer. Say if it was, I really don't know that many people. Let's say it's Walter Cronkite and Abraham Lincoln in these roles. I just picked some famous person. And I would expect Cronkite to be like, okay, you're right. We're not going to go down this road. This is something personal. You didn't come here to talk about that. We're moving on. This is a medical treatment, medical diagnosis that you and your doctor are working with. And so this is not meant to be public knowledge. Only you're allowed to reveal what you want. That's just basic good manners. And so that was just the frustrating thing with me. I thought it was going to be more about, oh, what's going on with this type of treatment? How is this being used? How is it going more? But it seemed more like an attack on Elon Musk, and I was just kind of depressed. I was like, oh, I was hoping for more new information, new studies, or things like that. But no, it was Don Lemon attacking Elon Musk for taking his pills, which is pretty low. Pretty low for someone who struggles with depression. I mean, oh, you get depressed and you take medicine for it? you should feel bad. That's terrible. No, I didn't listen to any other topics. I just wanted to listen to this one because I'm intrigued by it. I follow it, and I'm just kind of wanting to know more about this. And have been just casually monitoring it as it hits news cycles and things like that. But this is just one of those things where I think I think any medical treatment that is prescribed and overseen by a doctor is a legitimate medical treatment, and you should not be shamed for it. And that's what we saw here. And that's just what this video is all about. Is if you've got if you suffer from depression or anxiety, please, please, please seek help from someone who knows. Sometimes when this anxiety gets too much and the depression gets too much, the worst thing you can do is be alone and be secluded and be isolated. So if you're out there and you're struggling with depression or anxiety that cripples you, or even just affects you on a major level, not just feeling sad, but really debilitates you and just puts you where you can't do anything, please seek help. Please seek out, please go see your doctor. Tell them what is going on. Ask them how you think you should proceed. Most doctors do one of two things. They prescribe you to a specialist who specializes in this or prescribes a medical treatment and almost always recommend a counseling treatment in unison with it. Because sometimes it's not just a chemical imbalance. Sometimes there's issues that you've been putting down and just pushing inside you down, 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 and you haven't dealt with. Please reach out. I mean, I'd rather sit here and listen for 36 hours, the story of your life, than attend your funeral. So, this is why this is an important topic to me. Because this medical condition exists and it should not be stigmatized. That's the word I was looking for earlier. Stigmatized for taking medication to treat this medical condition. You shouldn't. I don't stigmatize you. You have a problem and it hurts and you're seeking help. I'm going to be on the sidelines cheering you on all the way. Your families and friends should do the same. And anyone that doesn't, tell them to leave you alone. Because there's those of us out there that will cheer you on all the way. And as I close every video, I especially mean it today. I love you all. And there's nothing you can do about it. Be safe.